Traumatic brain injury has been referred to by the Center for Disease Control as a silent epidemic. There is estimated to be between 4 and 5 million new incidents of traumatic brain injury every year. Unfortunately, several months after a mild traumatic brain injury occurs and a CT scan or MRI is obtained, it will often be normal, at which point the patient is left wondering, what's wrong with me? There are microscopic changes in the brain that are not detectable by standard imaging techniques, but the SPECT imaging that is performed here can pick up these problems.
I was a patient of CereScan as a result of traumatic brain injury incurred through military operations, whether it be training or combat related. I remember lifting through the air, the black plume of smoke and the oil, and I believe when I connected with the ceiling of the Humvee, I was out. And I can laugh about it and tell the story because you always talk about the ones you get away from, but the residual effects and everything that occurs afterwards is a different story.
As a tight end and doing what I did, I was getting hit all the time and getting repetitive concussions. After my playing days, I started to see a big change in myself and almost a self-destruction of life. It wasn't me. My intelligence level, my attention span, all those things really changed. And I knew there was something wrong, but I didn't know what, and I didn't know how to fix it, and I needed answers.
Not even the doctors in the United States Army could identify with what it was. Was I crazy? Was it bipolar? What is this that I'm having a hard time controlling? And so when I came in and they said, yes, you have moderate to significant traumatic brain injury, I felt relieved.
They called me after my second scan. I was able to talk to them freely because of how open I felt with them about getting help for myself so that my life didn't continue spiraling downward.
So I think being able to have a reference point is really important, because if you know what's broken, sometimes it can be fixed.
And they gave me a chance to get back on my feet, and with understanding all this and with their help, it's been life-changing. It really has.
People don't have to live a life of misery if they've got a brain disorder. They do not. And coming to CereScan, it could be, and in many cases is a key component of making that a reality. And for those who are sitting out there who have got chronic situations where they're not improving, we're absolutely the go-to place in the United States to help unravel those mysteries.
CereScan means everything to me. It's meant everything to me, and it continues to.